Thank you.
Brilliant. Okay, so Bronya's already introduced me, so thank you very much for giving me some time today to talk to you about a subject close to our heart, which is PPI. Okay, so this is just to give you a definition of what we're talking about with PPI. This is a definition which was developed by Involve a few years ago. So public involvement in research means research that's done with or by the public, not to, about, or for them. It means that patients or other people with relevant experience contribute to how research is designed, conducted, and disseminated. And you can see by the words that I'm highlighting here that it's very much about a two-way process where you give public and patient members genuine, meaningful involvement in it and influence in the research that you're designing and delivering. Who are we talking about with patients and the public? It's quite a wide range of people, really: patients, potential patients, carers, people who might use healthcare services. It could include anyone, really, and the exact type of groups that you involve in your research will very much depend on what your research question is and what expertise you think people could bring to the table. And it's perfectly usual for people to involve more than one of this type of group in your research and your PPI activities. So if that's what PPI is, it's worth just touching on what it's not, because people do get a little bit confused about some of this. So first of all, it's not engagement. So you'll often hear people talking about research engagement. And that's more a process where you're kind of getting out into the community and letting people know about what it is you're doing or what it is you've done, with a view to that information being useful to them. And whilst it's really important, it's not that kind of two-way process that we're talking about with involvement. PPI is also not participation, so people who take part in your research are obviously very important, are contributing data that will influence the outcomes, but those people are not actually influencing the design of your research, so it is a slightly different thing. And we do often get researchers who will say, oh, I don't need to do PPI because I've done some qualitative research, so we've already spoken to people. But again, qualitative research is not the same as PPI because you're in charge of it. You decide what the question is and how to analyse it. Involvement is a much more of a two-way thing. Now, I've put them overlapping because one can often lead to another, so there are some similarities, but what absolutely doesn't involve and doesn't belong in the circle is tokenism. So this idea that, oh, we have to involve some patients and members of the public, let's just go and speak to them and then we can write down that we did that. That's not meaningful or helpful for anyone and is quite demeaning to the people who get involved with that. So please don't do that. It's really easy to spot when somebody has done that in an application. So it is very likely to be picked up if you do. The other thing to say is that PPI is a process. So often people are like, oh, well, we'll do our PPI now. But actually, the best kinds of research will embed PPI throughout. And that PPI will evolve over time and change over time. And that's perfectly usual and acceptable. So try to think of PPI as something that will develop rather than a kind of one-off tick box process. And I think we've already discussed in previous session as to why PPI is important, but really it's about strengthening and improving the research that we do and making sure that the kind of unique insights that you can only get through living through an experience and becoming expert in sort of living with a condition or a situation. And we really want to design research that answers important questions to patients and the public, makes a real difference to people's lives, and is accessible to all people. So lots of different types of people can take part in our research. And to do that, we really need to go out and speak to those people to understand how it is that we can design our research in the best way possible. Even if you're not sold on the idea of PPI, your funders are, so it's really important for you to consider that. So all NIHR applications request information about PPI. If you don't have it, you have to justify it, and it's not enough to say we don't have patients included in our study, or our study is really complex, or involved. That's not a justification. You should always be able to find a way to involve patients and the public in your work. As Bronya's already outlined, all NIHR applications request a plain English summary. They're all scrutinised for PPI elements, and they'll all be reviewed by at least one lay member of the funding panel. Obviously, this is about NIHR, but this is applicable to all the major funders. They all will seek information from you about how you've done your PPI and what you intend to do. And it's not just about what we get out of it. Lay contributors also can get a lot out of involvement in PPI activities. And this is just a word cloud of information from consumers who work with the RDS in North East North Cumbria. And you can see they're all very positive words there. And we know that lay contributors often get involved in this kind of work for really altruistic reasons, that they want to help others, that they want to make improvements. And I put this slide up really just to emphasize the responsibility that you have as a researcher if you're involving lay people, to be respectful of these, the reasons that they're getting involved, and work in ways that allow them to meet these aspirations of helping others and making improvements. So these are some of the questions that researchers will often come to us with in the RDS about their patient and public involvement. And obviously this is a short presentation, so I'm not going to go through all of this. And actually the headline is that there is no one-size-fits-all approach to PPI. It's very much about what your project is and what you hope to achieve from it. What I would say is that if you sit down and think about what your research is about, and think about where would involvement from a public or patient member be valuable, where would that expertise help, what don't you know at the minute that somebody like that could answer, then these sorts of questions start to become more apparent to you, the answers to these questions, sorry. Also bear in mind, as I said earlier, it's a process, so these things can change over the course of you developing the project and delivering the project as well. So don't feel that you have to be fixated on one idea and then follow that all the way through. Sometimes these things can develop and you might bring more people in, for example, different groups of people in as you discover more along the way. I will just touch on when, though, because that is quite important. So the headline here would be do that as soon as possible. Okay, so we do get researchers coming to us and saying, oh, I want to really develop my research idea and my application and my question before I go and speak to members of the public, because I want to look professional. But actually, if you do that, that doesn't give people much scope to actually get involved. If you present a very well-crafted protocol, then members of the public might feel, first of all, that they would feel embarrassed to suggest anything different because they can see you've put a lot of work into it. Or if they do suggest something different, then that means that you have to go back to the drawing board or ignore them, which neither of those things are palatable. So involving people right at the outset when you're starting to have an idea is the best way for you to get their involvement and also to develop the relationship, a really kind of meaningful relationship that will help you to get really good PPI and get that involvement. You can also involve patients and the public really at any stage within the research sort of life cycle, and there's lots of ideas here about different ways that people could be involved at different stages, and we've certainly seen all of these really coming through the Research Design Service in the North East North Cumbria. Again, there's not a one-size-fits-all approach. The thing that I would really advise at any point really is to speak to the people who you are involving and get their ideas about where they'd like to be involved, where they feel that the public could or patients could get meaningfully involved and support you in the work that you're doing. Here's just some examples of ways that people could be involved in research. So people, lay people can lead grants or be joint grant holders, be co-applicants, which I think we've touched on earlier this morning. Again, this is not a hierarchy, it's not an exhausted list, so there's lots of different ways that people can do it, and there's lots of innovative ways that people are getting patients and the public involved. And there's not a hierarchy either, so it's not about, well, you should aspire for all of your research to be kind of led by patients in the public, because that's not realistic and it's not always the best answer. So it really is about sitting down with people, with lay people, talking about what it is that you want to do, getting their views on what they would want. Not every lay person wants to be a co-applicant. They don't always want that responsibility. So it might be looking at, well, what other ways could they get involved in a way that's comfortable and accessible to them? Okay, so tips for a good application. So this is true for any aspect, not just PPI, but your application needs to be clear and consistent to the reader. You need to be clear about what you've done, how you've done it, with who, how, etc. The funder will want to know, is it appropriate and comprehensive enough? Have you involved the right kind of people, and have you involved them in a meaningful way? I think Rosemary mentioned this morning about showing legitimacy, talking about how the PPI has contributed and giving examples of where you've made changes as a result of that PPI activity. Diversity and inclusion is really important. So it's involving different groups of people will make your research more accessible and meaningful to a broader spectrum of the population. So that will be scrutinised. Don't feel constrained to the PPI section of an application. So there will be a section where you'll detail your PPI, but you can actually talk about it throughout. So in your project plan, for example, and you're talking about the different methods you're going to use, you can discuss any element of that has been led by your PPI advice. You do need to resource PPI appropriately. And the expectation will be in any funding application that a chunk of that will be dedicated to PPI activities. So don't feel like you've got to kind of keep that to reduce costs, because the expectation is that it should be there. NIHR do have guidance released earlier this year, I think, around the suggested rates for different activities, which you can draw upon. It is complex. I don't have time to go through it all in this presentation. So, for example, if people are on benefits, it can get quite tricky, but the NHR guidance does provide a lot of information on that. And your PPI advisor with your RDS will also be able to talk you through some of those things. And think about whether you want to be guided by a framework or standards. So there are the UK standards for public involvement you can draw upon. That can give you quite useful information to take you through the process. So obviously, I'm going to give you a plug for the Research Design Service, since we're hosting this. We do employ across the country, 25 full or part-time specialist advisors, so people that have a specific interest in PPI and can give you advice for free about the work that you're planning to do. We also work with lots of very knowledgeable public contributors who support both us and our clients. And we can provide advice and support, including individualized support. We can facilitate links with patients in the public. We can, as Gordon mentioned, there is a fund for people to apply to if you need some resource to fund your PPI activities. We hold specific PPI training events, and we can signpost you to further support within your organizations or beyond. There's some useful links there, so I think these slides will be shared at the end, so you'll be able to click on those if that's useful. And you, as I say, I would encourage you to contact your local RDS if you need support around your PPI, so we can talk through the specifics of your work.